The saying, "we are what we eat," brings a lot to the table. Eat healthy, fresh food, and we do better. Eat a diet of overprocessed food, not so well. Eat to your health. Tonight, on call with the Prairie Doc, celebrating our 20th season. Hello, I'm Dr. Deb Johnston. We are approaching the halfway point of this season and the celebration of 20 seasons of truthful, tested, and timely medical information. Continuing that tradition is our goal for tonight's discussion, which features the topic of nutrition. Before we begin with your questions tonight, we thought this would be a good time for a short COVID update. On call with the Prairie Doc producer Ginger Thompson visited with Dr. David Bassel, Vice President for Clinical Quality, Avera Medical Group, about the current state of the pandemic.
After seeing a very steep increase in COVID cases and hospitalizations through both August and September, October we were very flat on the number of cases we were seeing. And now in the first half of November, if anything, we're seeing upward pressure again. We just never dropped off during October, kept thinking we'd peak, but now, if anything, we're starting to gradually climb back up even a little bit higher. So we just aren't seeing the tail end of coming back down yet.
Can you explain why that might be?
Yeah, that's a great question. Kind of all of the northern Midwest, we're seeing that, pretty sustained high level of transmission. And part of it's got to be because the weather's changing. We're spending more time indoors and a little bit closer conditions. Definitely seeing it in the younger age group. We're seeing it in our schools. So I think it's kind of that reservoir in the schools getting passed around where some of the younger children don't show as many symptoms. And so I think bring them back and pass it around to the families. Kind of a combination of factors. I think we're continuing to see it.
And now there are COVID vaccines for younger children. Are they not getting the vaccines as quickly as you'd like, or is it just taking a while for as many as possible to get vaccinated?
Yeah, so vaccines in general, we feel are the only way we're going to get past this and get to the other side. And so certainly anything we can do to increase the number of people being vaccinated, including now children 5 and above. And we did see initial, pretty healthy interest in the vaccine among those younger age groups, and it's kind of leveling off a little bit now, but certainly need to keep pushing, getting more vaccinated. Got my 8-year-old daughter vaccinated a week or so ago, so happy to do so.
So we have maybe about 2/3 of our adults vaccinated in this state. What's going on with the rest? They're just not believing in vaccines, or why can't we get over that hump?
Yeah, so multiple reasons. I think every individual who has not gotten the vaccine at this point has kind of their own reasons. Some of them feel that they've already had COVID and so that they should be somewhat protected. What we're seeing with those individuals, though, is that over time that protection is decreasing, and we are seeing reinfections from those people that have previously been infected. And that's what the studies nationally are showing as well, is that natural immunity just isn't enough long term and that you still need to be vaccinated. The good news is if you have been infected in the past, that you get kind of almost a super immunity from the vaccine plus previous infection, and you're really well protected at that point.
We cannot emphasize enough how important getting the vaccine is. Joining us tonight here in our studio on the South Dakota State University campus in Brookings is Dr. Kendra Kattelmann, a PhD and Director Distinguished Professor of the of the South Dakota State University School of Health and Nutritional Sciences. And via Zoom from Sioux Falls is Dr. Dawn Flickema of Avera Medical Group Integrative Medicine. Welcome. And Dawn, you and I have a long history together. We were actually co-residents a million years ago. Tell us, what is integrative medicine?
So integrative medicine is really kind of taking into account the whole person when we're working with patients. We often see patients that maybe have chronic medical conditions that they're looking to optimize. And so we look at their nutrition, their sleep, lots of other lifestyle factors, stress management, work environment, and help them manage those lifestyle factors to optimize their chronic conditions or optimize their wellness.
Fantastic. I think that's something that we all could use more of. So that's a great field. So, and Dr. Kattelmann, what drew you to dietetics?
Well, I like to eat. I started in dietetics many years ago, and it was a profession that combined, and I liked chemistry. It combined chemistry with food. And of course, we don't receive any nutrients unless we consume food. Well, we can through pills, but most of our nutrition comes through food. So I like to eat.
And I think that's really important, because I think that we have this idea in our culture that there should be a lot of shame around food and good foods and bad foods and what we should do and what we shouldn't do. And I think food should be fun.
Food should be fun. You should enjoy what you're eating. Make it a pleasurable time. We should enjoy what we're eating. We have, because we've had obesity issues, not just in the U.S., but worldwide or nationwide, people often try to put good and bad things with food, but we really need to enjoy it. Mealtime should be fun. We should enjoy what we're eating.
Dawn, what do you have to add to that?
I think those all sound like great suggestions. I would add that, I think with our busy lifestyles in the United States, we've kind of gotten away from the family meal. And I think getting back to that routine and modeling good, healthy eating habits for our families and our kids, and also having that family time to sit down and socialize and connect as a family, that is really all kind of part of that nutrition information that you're putting into your bodies.
I love what you said there about modeling. I think that's so important that, the adults model those healthy behaviors for the next generation. And that means they have to have some confidence in those behaviors themselves. And that means they have to do them for themselves too. So that's an excellent point. Let's get into some questions here. We have a viewer from Webster who wants to know if nuts are healthy for you. Kendra.
Absolutely, as long as you don't have a peanut or a nut allergy. But the dietary guidelines recommend that you have what we call a palm-sized portion of nuts daily, if you can.
Dawn, are there particular nuts that are better choices than others?
Totally. I think I love nuts. I eat nuts a lot. It's a great source of protein and a healthy fat. And I think variety is always the spice of life. So, choosing or, switching it up and eating a different variety of nuts. There's lots of research that shows, walnuts, almonds, pumpkin seeds, all kinds of nuts have lots of different health benefits. Brazil nuts, even kind of some of the strange ones. So
I love Brazil nuts. Don't call them strange. They're some of my favorites.
So they're a great source of sulfur.
There you go. I don't have enough sulfur in my diet, so I need more Brazil nuts. Yeah. Hubby, order me some. We look forward to answering your questions about the importance of diet to your health. Call 1-888-376-6225. Send an email to ask@prairiedoc.org or ask us on our Prairie Doc Facebook page. And to encourage your questions, those of you who ask a question during the first 20 minutes of tonight's program will be entered into a drawing for one of our Prairie Doc gift items. The winner will be announced at the end of this program. Your question will remain anonymous, but be sure to provide your name and contact information when you submit your questions so we can contact the winner. All right. Here we have a question from Brookings. If you would change one thing about the typical American diet, what would it be? Dawn, what's your pitch?
My pitch would be eat more vegetables.
I love that one. You took my answer, Dawn. How about you, Kendra?
Well, in addition to eating more vegetables, I would say consume less sugar-sweetened beverages.
And a better variety of things, I think, is another really good point. And here's another question. What is the harm in diet soda? Kendra.
In moderation, the research shows that in moderation, there really is not a harm, okay? Again, though, if you're consuming it in amounts that you would be, what I say is moderation, 1 soda a day. And if you're consuming it in place of water, that's not moderation. So as in moderation, we haven't seen any negative effects with it in the research. There's a lot of research saying that it increases your appetite, but that really, or it's trying to say it increases your appetite, but the research doesn't support that.
Do you have anything to add to that, Dawn?
Sure. You know, I think a lot of your total body health has to do with that gut ecosystem that exists in your body, in your colon. And any kind of an artificial chemical oftentimes can be toxic to that healthy gut ecosystem. So in trying to really optimize that good ecosystem in your gut to do good things for your body, again, in moderation, really limiting consumption of those artificial sweeteners is a good idea.
I think some people, too, are sensitive to caffeine. So we have to be conscious of how much caffeine that we're getting. And sometimes people forget that a lot of diet sodas have a lot of caffeine in them, too. Yeah. I say as the person who probably drinks more caffeine than anyone else in the studio. Caller from Esteline says, sugar seems to be blamed for everything. Is it really that bad? What amount is felt to be safe? Kendra.
So, overconsumption of sugar is excess empty calories. And once again, the sugars from the natural sources or the sources that are already there would be what we need. We don't really need the additional sugars in our diet, adding those calories that are not nutrient dense. And as we're talking about the gut bacteria, the gut bacteria really needs complex carbohydrates versus the sugars, which are simple carbohydrates. Mm-hmm.
So, often people look at sugar and they look at all carbohydrates and they paint them with the same brush. Dawn, are all carbohydrates the same? Are all sugars the same?
No, absolutely not. So again, a lot of just like Kendra mentioned, your fuel, your carbohydrate fuel for your body should really come from those plant-based foods. So fruits and vegetables have carbohydrates in them, and fruits are not bad foods. Fruits are good for you. And when you're consuming sugars in combination with the fibers in those plant-based foods, metabolically, then your body can handle those sugars much better and do what they need to do with it to make their own energy. I think, too, the other thing I would add is that Americans need to be better at reading labels. There's a lot of hidden sugar in many foods. And I've seen statistics that, in the early 1900s, Americans consumed 5 pounds of sugar over the course of a year. And now many Americans consume 75 to 100 pounds of sugar a year. So that's really way more sugar than we need. We're seeing the health repercussions from it in chronic illness. It creates a lot of systemic inflammation in the body.
Yeah, sugar is one thing, carbohydrates are another thing. So we need to make sure that we mentally keep those separate. And I like your point about reading labels. That's a really important skill for people to develop. So We have a caller from Mobridge who wants to know what the current recommendation on when to start solid foods in infants is. Dawn, do you want to talk about that?
Oh my gosh, maybe you're better to talk about that. It's been a while since I've done food recommendations in infants, but we recommend, the recommendation is breastfeeding mostly for the first year of life, and then slowly introducing some of the solid foods. I think the longer you can delay that, the better. I've seen, seems like average agreement is around 6 months.
Yeah. I usually tell parents that your baby will tell you when they're ready. They'll sit there, they'll be able to sit, they'll hold their head straight, and they'll start acting like a baby bird when they're watching you eat. So they're letting you know that they're ready, and that's somewhere between 4 and 6 months, and 6 months is the typical goal. Kendra, what do you usually recommend that parents start their children out on for foods?
Well, the research is showing that you really can start them on any food at 6 months.
Except honey. No honey.
No, well, yeah. No honey, but I mean, we used to say rice cereal because they were thinking about allergies, but if you wait till 6 months, you can start on any category of food, fruits, vegetables, meats.
Yep. You just want to make sure that the texture is something that the baby can handle.
Right,
so
yeah.
Even table food. There's nothing magic about baby food. It's just the texture and the repetition. So, and that's a great segue into our next segment. So thank you, caller, for bringing that up. WIC, also known as Women, Infants, and Children, is a nutrition program that promotes bettering the health of low-income families. Prairie Doc reporter Esther Michael tells us about the importance of WIC and the common misconceptions.
WIC is the supplemental nutrition program for women, infants, and children provided through USDA Food and Nutrition Services. So it's a federal program, but it's administered by the state health department. People who qualify for WIC are those who live within the state of South Dakota and meet our income guidelines of up to 185% of the poverty level. So that would be, for example, a family of 4 having $943 weekly or $4,086 monthly income into the home. So participants are also those who are at a higher nutrition need. So our population includes pregnant women, women who have recently given birth or are breastfeeding a baby, and their babies and children up to the age of 5. So our food packages are all specifically tailored to provide foods for people in those stages of life.
McGlade explained that some people believe WIC is a welfare program. However, that is a misconception. There is a large quantity of working moms within the program. WIC is an additional support system to mothers as they continue to raise their families.
We actually are a nutrition education program. So we help families make healthy eating choices and live a healthy lifestyle. So we have registered dietitians that provide evidence-based nutrition education for our families. So when you come to WIC, you're actually getting high quality nutrition education from trained professionals. We also have nurses on staff who provide WIC services and offer other services like providing safe sleep education, mental health support, immunizations for those who need them, and screening for developmental delays, to just name a few things. We also provide breastfeeding education to help pregnant moms learn more about breastfeeding and to help them make feeding decisions and prepare to breastfeed if that's what they choose. And then also to support moms who are currently breastfeeding to be their cheerleaders when things are going well, and then to help troubleshoot any issues that they might have along the way. So in addition to having staff who've received training to obtain their certified lactation counselor certificate or CLC, we also have a breastfeeding support program that's provided by other moms who are either former or current WIC participants that have breastfed for at least 6 months themselves. And these women are available 24/7 so that moms have an opportunity to ask questions or get support any time of day. And that's mainly via phone or text messaging.
Low-income families and pregnant women are at a higher nutritional risk. Foods such as pastas, cereals, lactose-free milk, and various other foods are provided within the WIC program. Recently, WIC is offering a large amount of vegetables and fruit through the end of this year.
And for women who are breastfeeding, we also can offer canned fish. And women who are breastfeeding actually get the largest food package to support their nutrient needs while they're breastfeeding. And for those who cannot or choose not to breastfeed, we also provide infant formula. And we provide baby foods and infant cereals to make sure our little ones are getting a great source of iron and other nutrients when they start foods.
You know, one of the things that's really changed and I think plays into WIC, you know, when Dawn and I were going through residency, boy, peanuts were verboten, you know, no peanuts for babies. We were really worried about the allergy. What are the current guidelines for peanuts? You know, we just talked about how important nuts are for our diet. What's the current guidelines on peanuts?
Yeah, I'm the same as you. When I was going through school, we were told not to introduce peanuts until much later, a year or 2 years. 2 years. Now they're indicating that you should introduce peanuts somewhere between 4 and 6 months. As you said, though, you wouldn't recommend.
I don't want a peanut. Don't give that baby a peanut.
But one of the recommendations is use a peanut flour and put it in a little liquid. But it might be better just to start introducing it to them once they're on solid foods.
Yeah, once you're taking solid foods,
Yeah.
I think, you know, we do peanut butter cookies. You know, there's our added sugar again, and peanut butter in things. You know, is a great way to get some peanut exposure to the babies. It's really just honey because of the botulism risk we don't want babies to have until they're 1 year of age. And I don't recommend cow's milk until 1 year of age, nothing but breast milk or formula because babies aren't ready to digest that yet. So otherwise, keep going with the peanuts. And I know WIC peanut butter is one of the foods that's provided to WIC families. So.
One of the recommendations, if you're doing that, and you know, peanuts can be, or the peanut butter can be sticky to the top of the mouth, is they put it in a little bit of water and make a slurry with it.
Yeah, that's a good suggestion. I think we all have that issue of the peanut butter sticking to the roof of our mouth. So here's a question that kind of referred back to what we were talking about a little earlier, and I think that this is a good observation. This caller had made an observation about the addition of corn syrup to so many of our foods. Why, and what can we do and should we avoid it? Should we avoid it? Dawn? Corn syrup sweetened.
Yep. Yes, we should avoid corn syrup. And I think that's where a lot of those hidden sugars are, that there's many other sugar substitutes such as date syrup and corn syrup. And I have a presentation that I do that I show a slide that there's 61 names for sugar. So again, that really kind of makes it important to read those labels and really understand what you're consuming in your food.
Yeah, it'd be nice if they didn't add so many of those things, but I think a lot of companies find that it makes people crave it more. It makes it taste really good because we're used to that sweet, and it sells better. So it's not good for you. Avoid it as you can. So we have a caller from Sioux Falls wondering what fruits and vegetables are most beneficial for a diet and which ones we might want to avoid. Kendra.
I say a variety of fruits and vegetables, and if you go by the dietary guidelines, you should have some dark orange and some dark green daily, or at least a couple times a week. I don't have you avoid any fruits and vegetables. Now, we like potatoes in South Dakota.
And
corn and peas, but there are more than those. So it's the color. Choose by different colors and have different colors every day. Something more than corn, peas, and beans. Add to your diet.
Dawn?
And I would totally echo what Kendra is saying. We tell people to eat the rainbow. So eating all those different colors, the colors in the plant really are demonstrating the different, we call them phytochemicals, or chemicals that are specific to the plant. And those are those good beneficial chemicals that our cells use and help our cells to do their job better.
We have a viewer wondering, how important is it to buy local and fresh food? Is that the only thing I should be looking for? Kendra?
So local food, the advantage is it supports your local farmer, okay? It supports that local person who's producing it. And it also tastes better because it's picked when it's ripe. Nutrient-wise, there's not any difference whether it's grown in California or whether it's grown here. So, but sustainability, if we're talking about local foods, are ripe during season. So then you have seasonality with it, so you're supporting sustainability, because then you're, rather than having all that food trucked from California here. If you can't, now, again, frozen foods are frozen when they produce them. They freeze them very near the field, so the nutrient quality is there. So that gives us an opportunity to have things when they're not in season. Canned foods have a little salt in them, but if you're on a limited income or you're in an income pinch, or a
storage pinch.
A storage pinch, canned fruits and vegetables really fill in there. You'd want to try not to have fruits that have added sugars with them. So they can add to the diet.
Yep, absolutely. Frozen is really convenient because I can portion that out and put it back in the freezer. So I don't have to eat that whole can. I can have just a little bit of my broccoli or my blueberries or whatever it is. So it's a convenient supplement.
Yeah, it's already cleaned and cut up for
yes.
you too. So
that's a nice thing
yes.
too. All right. So we have someone who wants us to talk about celiac disease. Dawn, I imagine that's something, that gluten issue is something that probably comes up for you in your practice a lot. What do you have to talk about?
Well, there's definitely a lot of interest in gluten. And, I think unfortunately, food companies have kind of jumped onto that bandwagon. Again, with that food labeling, you see lots of labels that say gluten-free. And I try to encourage people to look at those labels, and just because it says gluten-free, it doesn't mean it's healthy. So celiac is somebody who has an absence of the enzyme in their gut to be able to digest that gluten, protein, and wheat. So those patients really do suffer significant symptoms if they consume wheat. Most typically, it's gastrointestinal symptoms with stomach cramps or diarrhea or even bloody stools. But sometimes celiac can be a little bit serendipitous, where people have more systemic effects with it, and it may not necessarily just be gut issues. There are rashes that can be go along with celiac as well. So you may express it more as a skin inflammation issue versus a gut. In our world, we also work with patients who maybe we call it a gluten sensitivity. So it's not celiac disease. They're not completely missing the enzyme, but they have maybe some inflammation in their gut that they're having difficulty digesting wheat. And those people often do benefit taking gluten out of their diet for a period of time and then reintroducing it back in moderation on down the road.
Now, how about celiac patients? Can they reintroduce that, Kendra? Can they reintroduce gluten?
No, not if you have a true celiac diagnosis. You need to avoid it. And what you were saying about that fad diets, with a lot of people think gluten-free is healthier. It's healthier for the person who has celiac disease, but it's not healthier for just any person. So there are some nice things that have come out about having this fad of a gluten-free, is that things are now labeled, so those who have it, it's much easier to find the product.
And to find something that's gluten-free,
It's
to have a
because-
good substitute,
Yes.
and to know, oh gee, I shouldn't eat that turkey because it's been injected with gluten.
Right,
Yes.
right, yeah.
Your diet and the types of foods you eat can greatly affect your heart health. Prairie Doc reporter Carter Schmidt spoke to a cardiologist who is also an electrophysiologist to find out what changes you can make to benefit your heart.
Dr. Jose Teixeira focuses heavily on lifestyle medicine and preventing chronic diseases before more issues develop. He says 50% of Americans have some form of cardiovascular disease. Changes in lifestyle can reduce those chances.
You have to ask the question, what do you want to accomplish? If you're just trying to prevent cardiovascular disease and other chronic diseases, you don't have to be as strict as if you already have them and you're trying to reverse them.
Teixeira says if you are trying to reverse a condition such as coronary artery disease, you must have a whole food, plant-based diet. However, even people with no medical issues should make healthy lifestyle changes.
Improve their diet. And we're talking about 5 servings of fruits and vegetables a day. If they exercise regularly, we're talking about, 30 minutes, at least 5 times a week of moderate amount of exercise. If we brought our weight to a normal range, we call the BMI, the body mass index, to less than 25. And if we didn't smoke, if we did all those 4 things alone, you will dramatically improve the health of ourselves and our communities and the country, as a whole. Unfortunately, only 3% of Americans do all those 4. If you are age 50 and you adopt those, for men will live extra 14 years, for women will live an extra 12.2 years.
Even making slight changes can have a big impact on your overall health.
It's not all or none. If you just don't change anything, but increase 1 serving of fruits and vegetables a day that you were not doing before, you're already having a significant health benefit. It's not just a matter of living longer. You want to add years to your life, but you want to add life to your years. You want to increase quality of life.
We've gotten lots of good questions from people here tonight, so we're going to work on getting to as many of them as we can. We have a viewer from Watertown who wants to know if there are any natural treatments, not chemo, for a diagnosis of cancer in the lymphatics. Dr. Flickema.
There are some treatment centers in the United States that do more of a integrative approach to treatment. There's some information out there about nutrition. There just unfortunately isn't enough study yet to really say that would be an equal substitute for traditional treatment.
Yeah, I would never recommend that a patient avoid traditional treatment, but I would very much recommend that they work on the support with the nutrition and the sleep and all the stress management, and those can be such a critical support. But I would be very, very hesitant if one of my patients just wanted to pursue nutrition as a substitute. We have a caller wondering if there are any foods known to cause or enhance the symptoms of COVID. I'm going to throw that one to you too, Dr. Flickema.
Wow. Cause or enhance. I could come up with a list of things that would improve your odds of maybe not getting COVID. You want to, again, kind of focus on those foods that are going to help, increase your antioxidants in your system. That's your any sort of an infection in your body is really a toxin, and it needs to be detoxified through your body's detox pathways. And those detox pathways really operate on all of those good vitamins and minerals that those whole foods provide for us.
May I add something to that?
Please.
There is no food that can take the place of getting vaccinated. So vaccinate it first, and then your healthy diet to support your immune system, but vaccination first.
Absolutely. The vaccination really primes your body to be able to fight, and then it gets that good support from good nutrition and good sleep and everything else. A caller from Delmont is wondering if a person eats a well-rounded diet, should you be taking vitamins? Kendra.
So there are calcium and vitamin D. Again, calcium would be if you're not consuming 2 cups. We have to be careful. 2 cups, and this is a cup and a half, by the way, of dairy products a day. As a female, you probably should have a calcium supplement. Vitamin D, because of our where we're living in this northern climate or northern latitude, that might be helpful for you, because it is hard to get enough vitamin D, particularly if you're not outside.
And with our emphasis on skin protection, sunscreen, covering up, a lot of people do need vitamin D, but a lot of foods are enriched in vitamin D. So if you really are doing a good job at eating that variety and eating a really good diet, you may not need that vitamin.
Yeah, you may not. You're right. Right.
Maybe.
You know, if you're eating some of the fatty fish and consuming the whole milk products that are vitamin D fortified,
which cheese is not.
I know.
Cheese isn't. It's the milk and the milk substitutes, the soy milk, the almond milk.
Yogurt a lot of times isn't fortified either. You have to read the label.
Yeah. Gee, it comes back to those labels again. Yeah. All right. We have a couple questions here, and I'm going to combine a couple questions. Wanting to discuss the whole food and plant-based diets, if that's a good diet, and someone else wanting to know about the keto diet, and if the keto diet is a good diet. Dawn, what do you tell your patients?
You know, I often tell patients that really nutrition is very individualized, and we are getting more and more precise with some of the genetic testing can even kind of pinpoint, you know, what types of nutrition a person may do better with, whether it's Mediterranean or low fat or low carb or those types of things. But, you know, short of doing a genetic test, I really recommend that people start with a Mediterranean style of nutrition. That is really the most studied nutrition and showing all the benefits of good health and even reversing some chronic diseases such as diabetes and prevention of things like cancer and Alzheimer's and all of those things. So we know from our studies and research that that is a good foundational food pyramid for most people, and then it's just really kind of individually kind of tweaking that for people. I've really kind of gone away from food fads where you eliminate food groups. And I think that's where sometimes people can get into trouble if they're not doing a keto style of eating correctly. I've seen patients really significantly increase their cholesterol numbers on keto diets.
Kendra, what do you have to add to that?
Well, so I agree with Dawn, because the Mediterranean diet is plant-based. It has protein in it. It has animal protein, but you have those fruits and vegetables, you have your whole grains with it. So it is plant-based with a little meat. And the dietary guidelines really are along that plant-based, and they emulate the Mediterranean diet. So we call it the Mediterranean diet, but it's really the dietary guidelines. And so I agree with you on the keto diet. You're leaving out groups of food that we could have a deficiency in. You know, nutrients, our dietary reference intakes, our vitamins and minerals, those are the nutrients that we know we need. there are chemicals in those foods, in those fruits and vegetables, and chemicals in the food that are beneficial to us. We don't know what those all are. And we don't, that's why we recommend a variety of fruits and vegetables, or a variety of foods with that plant base. And plant-based doesn't mean vegetarian. It means
it can.
It can, yes, it can. But the definition of it means that you have you have fruits and vegetables.
And once again, you have to be very conscious about what you're leaving out and how to make sure you're getting if you are vegetarian.
Yeah, I agree. Yeah.
We have another couple questions that I think are interrelated. We have a viewer who's getting radiation for prostate cancer and needs to be on a low-fiber diet until he finishes radiation, and they wanted some suggestions. And another person who wants some suggestions about foods to eat with gastroparesis. Dawn.
Well, as far as the gastroparesis go, there are specific gastroparesis food plans that usually the gastroenterology offices will counsel patients about. To be honest, I'm not terribly familiar with those food plans because I don't often counsel patients on those food plans.
And I hesitate to give general recommendations without talking with the client first, especially, but it's the types of foods with gastroparesis that you want foods that don't slow your GI tract down. So generally it's lower fat foods, lower fiber.
Easier to digest.
Easier to digest.
These would both be situations where this person would be very, very well suited to going and visiting a dietitian and getting some individual recommendations for their particular situations. We have a question about turmeric. Dawn, do you recommend turmeric to your clients?
I certainly have had clinical experience with patients that have trialed turmeric, whether it's in the pill form to help with inflammation or arthritis or things like that. Again, I really try to have people really look at food as their first medicine. There are studies that show that actually when you consume turmeric in the food form, it's much more bioavailable for your body to absorb and utilize. So in the grocery store, in the produce aisle, you can find a turmeric right there. I use it in my cooking, and you can just shred it and add it to vegetables or meats or things that you're cooking. And then there's also another product called Golden Milk, and that's turmeric powder that's been, that also has some added spices to it, and you mix it with like a milk-based liquid and consume it kind of like a hot drink. And so a lot of my patients really like that.
Does turmeric have a flavor?
I don't really taste a ton of flavor with turmeric. It tends to turn food yellow. And so sometimes in my house, that's a little bit of a hard sell.
That's the golden milk, though.
Yeah.
We have a question here about the holidays coming up and what options for types of foods to serve the guests, or what types of food to take when you're invited to bring a dish. Kendra, do you have any suggestions for people?
Again, I don't overeat, but I like to have my holiday foods, because they're some of my favorites. But I also make sure that if I'm asked to bring something, I like to bring the vegetable tray, with a bean dip, so that I do have an option if I want to have a little less caloric intake.
And to make sure that those things are available. A man says, I come from a family that loves to cook and eat, and this person has struggled with obesity all their life and tried many diets, and they find that a behavioral approach like Noom and Lose It helping. Any other suggestions, Kendra?
I agree with them. That behavioral approach of having a variety of foods and listening to what you're eating and enjoy your eating is the most beneficial, and not focusing on your weight. So you're not weight cycling, so you're stable. Focusing on lifestyle behaviors, increasing your activity through lifestyle is much better than weight cycling to be at a certain weight. looking at your metabolic parameters like the blood pressure, your blood glucose, using those as indicators of your health versus your weight.
Dawn, I'm going to ask you this one. Someone wants to know some of the names of all those different names for sugar that you mentioned.
Ooh, okay, well, I actually have the list. Do you want me to read some of them?
Read the top few for our people,
Okay,
so they know what to look for on those labels.
Let me grab it here. Kind of small writing, so I gotta.
We have our 50-year-old eyes.
Flex my eye muscles, yes.
Yeah.
So, and I bet you could just probably Google too, like 61 names for sugar. But like there's beet sugar, cane sugar, coconut sugars. Oh goodness, raw sugar, keeper syrup.
And all total, how much sugar should we aim to limit to in a day?
You know, when you look at studies with the microbiome, a tablespoon of added sugar, which equates to like 3 teaspoons of added sugars a day, is what most of those researchers recommend.
30-second take-home message. Kendra, what do you want our viewers to know and remember?
I want them to remember to consume a variety of foods and make sure they get their fruits and vegetables every day. Drink water instead of soda. And then enjoy their food.
Dawn, what's your 30-second take-home message?
Boy, I'm going to sound a lot like Kendra. You know, eat your vegetables. Probably the one thing I would add to that is, you know, try to do more cooking at home. Do some, you know, make that a family event. Do that role modeling for your kids and your grandkids. Let's make our next generation healthier.
Excellent. Thank you so much, ladies. The winner of our drawing tonight is Carolyn from Sioux Falls. Thank you, Carolyn, for asking a question during the first 20 minutes of the show. A gift will be sent to you, and we'll be back after this.
See the steam rising off? So this has probably been cooking about 4 hours.
The breakup of the Soviet Union, and those times were really hard for Georgians, and I'm sure for most, if not all, for most of the Soviet Union.
I went to medical school in Nairobi, Kenya.
I come from Uruguay, Montevideo, Uruguay.
In 1995, I had 4 trips here. In 1996, I had 3 trips here.
Obesity affects approximately 40% of American adults, and I've been one of them for nearly as long as I can remember. There are innumerable schemes that promise effortless or nearly effortless weight loss, and many diets that claim to be the best approach. Most of us recognize that if something seems too good to be true, it probably is. It's much simpler to identify the miracle potion advertised on our social media feed as snake oil than it is to sort through all the conflicting and seemingly changeable advice on what makes a healthy diet. Should we be cutting out fat or cutting back on carbs? Is there a particular combination of foods or spices or supplements that we should be eating to be slim and trim and healthy? In truth, obesity is a tenacious disease, and many people successfully lose weight with any of a multitude of diets. Many people are also unsuccessful with those very same diets. Between my second and third years of medical school, I had a month without work or structured academic obligations to study for the important Step 1 board exam. Every morning I would get up and exercise for an hour before I hit the books. I would prepare healthy meals and snack on carrots and celery while I read. I was determined to lose some of my excess pounds and set a good example for my future patients. At the end of that month, I'd lost 2 pounds. This was not at all what I had anticipated. I was frustrated, angry, and hurt. I felt that my efforts had failed. I felt that I had failed. Let's think about what success means. Although we may want to get down to our ideal body weight, very few people with obesity actually achieve that goal, especially without surgical help. From a medical perspective, losing just 5 to 10% of your body weight improves your health in a variety of ways. More importantly, the lifestyle changes that can lead to that weight loss have health benefits of their own. With the wisdom of nearly 30 years in medicine, I realized that by focusing on the scale, I hadn't seen something even more important. Eating fruits and vegetables reduces the risk of heart disease, strokes, cancer, and many other chronic diseases. Daily exercise strengthens hearts and bones. In short, even without weight loss, exercise and a healthy diet are good for you. Experts may debate the nuances of the best diet, but there are some fundamentals which can bring success with or without the loss of pounds. Eat a variety of produce and lots of it. Watch the sodium. Minimize processed foods. Avoid added sugars and trans fats. Your diet isn't something you are on or off. Your diet is the way you nourish your body every day, and success is the choices you make that support your health. I think we've seen almost universal agreement between all of us tonight, which is almost a little unusual. Get your fruits, get your vegetables, eat a lot of them, eat a variety, enjoy your food, all things in moderation. And get your COVID shot, please. Everybody get your COVID shot, wear your masks. If you're out and about and a lot of people, there's a lot of COVID out there. The pandemic is not over. We're really seeing a peak. Thank you to our guests, Kendra and Dawn, for volunteering to join us in discussion tonight. We really appreciate their input about good nutritional habits. If you would like to see and hear more episodes of this program, please like and follow us on Facebook and YouTube, or visit us at prairiedoc.org. Look for Prairie Doc Perspectives in your local newspaper, and be sure to look for the podcast of this program, Prairie Doc On Call, wherever you get your podcasts. From all of us here at On Call with the Prairie Doc, celebrating our 20th season of truthful, tested, and timely medical information, until next time, stay healthy out there, people.
We all want our friends, neighbors, and fellow South Dakotans to have the ability to make appropriate decisions about their health care. To do so, they need access to information from reliable sources, like our Prairie Docs and their guests. Hello, I'm Stephanie Herseth Sandlin, and I serve on the volunteer board of directors for the Healing Words Foundation, a 501c3 founded by Rick and Joni Holm. This year, we celebrate the 20th season of Prairie Doc programs, which are so helpful and important for all of us, especially for those who choose to live in more rural communities in South Dakota and neighboring states. Truthful, tested, timely medical information for 20 seasons and beyond. We can do it with your help. Please consider a personal or corporate gift. Go to prairiedoc.org and click on the donate button today. Thank you.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call with the Prairie Doc on South Dakota Public Broadcasting. Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
And with the ongoing support of these individuals and institutions,
Brookings Health System,
Ophthalmology Limited,
South Dakota Academy of Family Physicians,
Avera Heart Hospital,
First Bank and Trust,
Dakota Allergy and Asthma,
Vance Thompson Vision,
Monument Health,
Black Hills Medical Society,
Brookings Madison Flandreau District Medical Society,
Pierre District Medical Society,
Yankton District Medical Society,
Orthopedic Institute, Lake Poncet Sailing Academy,
Aberdeen Asthma and Allergy,
Dakota Bank,
South Dakota American College of Physicians,
and Swiftel Communications.